Good morning, everyone. My name is Wong, and together with my teammate, Mr. Lucas, Mr. Sunny, Miss Tara, and Miss Noel, we will be presenting about bone and cartilage, strength, flexibility, and support. To begin, let's look at the overview of our topic. Bone is a hard and rigid connective tissue that forms the framework of the human body. It supports body structure, protects organs, and works together with muscle to allow movement. On the other hand, cartilage is a smooth, flexible connective tissue that acts as a cushion between bone and allows smooth joint motion. Both bone and cartilage are vital for body shape, protection, and flexibility. Without bones, we will have no structure to stand or move. Without cartilage, our joint would grip together painfully. In summary, bone provides strength and support, while cartilage provides flexibility and cushioning. Now let's move on to learn about the bone in detail. I will pass to Mr. Lucas.
Thank you, Mr. Wong. Hi, I'm Lucas. Let's start by talking about the types of bones in human body. There are 5 main types, which is the first one will be the long bones, like the femur, which support weight and help in movement. Second will be the short bones, which are the carpals bone in the wrist, which provides stability with limited motion. The third one will be the flat bones, such as the skull and sternum, which protects the vital organs. The fourth will be the irregular bones, such as the vertebrae, which have complex shapes for specific functions. The fifth one will be the sesamoid bones, like the patella, which forms within tendons to reduce stress. Now let's look at the structures of the bone. The bone has 2 main layers. The compact bones, which is dense and strong, forming the outer layers. The second will be the spongy bones, which is lighter and filled with red bone marrow that produces blood cells. So there are also 3 main types of bone cells. First will be the osteoblast, which builds new bone tissue. Second will be the osteoclast, that breaks down and removes old bone tissue. The third will be osteocritus, which maintains bone structures and nutrition exchange. Functions of bones include support for the body framework, then protection of organs like the brain and lungs, movement when muscles pull on the bone, then mineral storage for calcium and phosphorus, and blood cells production in the bone marrow. In short, bones is a living, active tissue that constantly remodels itself to stay strong and healthy. Now I'll pass to Sunny to explain about the cartilage. Thank you.
Thank you, Lucas. Hi, everyone. I'm Sunny. Now, let's move on to the cartilage, which is softer and more flexible than the bone. There are 3 types of cartilage. Heightened cartilage. This is the most common type. It appears smooth and glassy, found in the joints and nose, fascia, and the end of the long bones. It helps reduce frictions and allows movement. Elastic cartilage. This type contains elastic fiber and is flexible. It is found in the outer ear and epiglottis, helping to maintain shape and flexibility. Fiber cartilage. This is a tortuous type of cartilage containing thick collagen fiber. It acts as a shock absorber and is found in the intervertebral disc and nerve meniscus. Now let's look at the structures of cartilage. Cartilage is made up the chondrocytes, which are specialized cells found in the small space called lacunae. It has a gel-like matrix that contains collagens. It's avascular, meaning it has no blood vessel. Nutrient rich it by the diffusions, which is why cartilage heals slowly when damaged. Functions of cartilage include the providing support and flexibility, reducing the frictions between bone in joints, absorbing a shock during movement, and help to maintain the shape of structures like the nose and ear. So cartilage may seem soft, but it plays a very strong role in keeping our joints and body parts flexible and functional. Next, Tara will explain how bone and cartilage different from each other. Thank you.
Hello everyone, I'm San Puyun. We are going to quickly look at the key difference between bone and cartilage, the hard tissue and the cushion tissue, in just 5 fast points. First, the cells that build them: bone use osteocyte, cartilage use chondrocyte. The most different is vascularity. Bone has a rich blood supply. This is great for healing a break. Cartilage, however, is avascular. It has almost no blood flow. That's why a cartilage injury takes so long to repair. Next, they fail. Bone is rigid and mineralizer with calcium. It's built for strength. Cartilage is flexible and non-mineralizer. It's built for bending and cushioning. For bone, growth stops after maturity. For cartilage, it can still grow in thickness, which help keep our joint healthy. Finally, their job, bone function, is support and protection. It's the body frame. Cartilage functions is flexibility and cushioning. It's the body's shock absorber. This structural difference between rigid vascular bone and flexible or vascular cartilage has significant implications for patient care, especially regarding injury and degenerative disease. Now, I will pass it to Noel to continue with the clinical aspect of bone and cartilage.
Thank you, Tara. Hi everyone, I'm Noel. For the clinical aspects, our group have chosen osteoarthritis, a common disorder that affects cartilage. This is a degenerative joint disease where the cartilage covering the bone ends wear away. When this happens, bones rub against each other, causing pain, stiffness, swelling, and less joint movement. This is common in older adults, especially in the knee, hips, and hands. Risk factors include aging, obesity, old injury, and repetitive joint stress. This is no full cure, but treatment can reduce symptoms such as exercise and physical therapy, pain medicine, weight control, and in serious cases, joint replacement surgery. This shows how important healthy cartilage is for smooth and pain-free movement. Now, I will pass back to Wong for the closing. Thank you.
Thank you, Noel. To conclude, both bone and cartilage are essential components of our skeletal system. Bone provides the strength, protection, and framework that support our entire body. Cartilage offers the flexibility, cushioning, and shock absorption that makes movement smooth and comfortable. They work together to maintain stability, protect internal organs, and allow motion. When either one becomes weak or damaged, such as in conditions like osteoporosis or osteoarthritis, our mobility and quality of life can be affected. So, maintaining strong bones and healthy cartilage through proper diet, regular exercise, and posture care is very important. That brings us to the end of our presentation on bone and cartilage strength, flexibility, and support. Thank you very much for listening.